President Donald Trump signed an executive order that has significant implications for gender-affirming care for young people across the United States. A result of this directive, several hospitals in Colorado, Virginia, and Washington, D.C. have paused gender-affirming care to evaluate the changes imposed by this order. The decision has created a ripple effect in the healthcare community, as institutions assess how to align their services with federal funding requirements. What exactly is gender-affirming care? This term refers to medical treatments designed to help transgender individuals align their physical bodies with their gender identity. For minors, these treatments may include puberty blockers, hormone therapy, and surgeries aimed at supporting their transition. Currently, such procedures are not very common among adolescent. Studies indicate that fewer than 1 in 1,000 U.S. teenagers with commercial insurance received puberty blockers or hormones over a recent 5-year period. The relevance of Trump's executive order lies in its potential impact on vulnerable populations, specifically transgender youth seeking necessary medical treatment. A directive mandates that any hospital receiving federal research and education grants must end practices described by the administration as chemical and surgical mutilation of children. Critics argue that language used in the order mischaracterizes standard medical practices for transgender care and contradicts established guidance from organizations like the World Professional Association for Transgender Health WPATH. It maintains that access to medically necessary care is vital for these patients. According to Carla K. Johnson from the Associated Press, Denver Health has confirmed it will stop performing surgeries on individuals under 19 years old while reviewing other types of care such as hormone therapy or puberty blockers. Meanwhile, Oregon Health and Science University, OSU, stated it would continue its services without interruption at this time, but is evaluating potential impacts from the new federal policy. References from various sources illustrate a divide in opinion regarding Trump's executive order. Hospitals have halted procedures due to compliance issues surrounding federal funds, a necessity since many rely on Medicare and Medicaid. Others express commitment to providing ongoing support for their patients. Christine de Leon from the Oregonian noted that Oregon has strong legal protections ensuring access to gender-affirming care, despite possible disruptions caused by federal directives. The impact of this policy change could be substantial. It may lead to increased mental health challenges among affected youth, who might find themselves without critical resources during formative years. Hospitals like Denver Health are particularly concerned about maintaining health standards amidst political shifts. In history, similar instances where governmental policies have influenced healthcare availability based on changing administrations' ideologies or political agendas, for example. Previous regulations affecting reproductive health services often faced legal battles and public backlash when they were introduced or repealed. Looking at the bigger picture, we see that this situation exemplifies ongoing debates surrounding individual rights versus governmental control over medical decisions, questions many people grapple with today. Also highlights how nuanced conversations about healthcare access can be easily politicized. In conclusion, Trump's executive order aims at reshaping federally funded healthcare services regarding gender-affirming treatments for minors amid rising concerns about mental health impacts on vulnerable populations. The response from various states and institutions indicates a complex landscape ahead involving legal challenges and societal discourse around transgender rights and healthcare access. It's essential to understand both sides of this conversation, so informed decisions can be made moving forward amid evolving circumstances.